new clinical study finds a single dose of psychedelic mushrooms, along with talk therapy, can be used to treat depression. The trial involved 233 participants in the U.S., Canada, and Europe. It focused on those with treatment-resistant depression, meaning those who did not respond to at least 2 other courses of antidepressants. The study found that 2/3 of participants recorded a significant improvement within as little as 3 weeks. Dr. Scott Aaronson is one of the authors of the study. He is the Chief Science Officer at the Institute for Advanced Diagnostics and Therapeutics at Sheppard Pratt Hospital. Dr. Aaronson, thank you so much for joining us today.
Thanks for having me.
If you could just walk us through how this medicine, psilocybin, was administered and what the typical process was like for a patient.
So we were screening people who had to have failed at least 2 treatments in their current episode of depression and no more than 4 treatments. So we're looking at a specific group of folks with a difficult-to-treat illness. Once they were screened in, we had to make sure that we were able to get them off of their current antidepressant medications. If they were unable to come off their current antidepressant medications or had too much risk in doing that, they were not included in the study. Once they were off for 2 weeks, they started a program of preparatory sessions with a trained psychologist to get them ready for the psychedelic experience. But they also had to be ready to be randomized potentially to not having a psychedelic experience. It's a little difficult when you're doing studies. Then on the day of the dosing, they came in early. We tend to do our dosings at about 8 in the morning. And then they spend the day in a room with 2 trained therapists ready to be of assistance if needed. But generally, they stay fairly quiet. They're listening to music. They have on eye shades. And we're looking for them to have an internal and inner experience during the dosing session, which lasts about 6 hours. At the end of the dosing session, the study physician, in this case it was me, would check in with the study participant, make sure they were well enough to go home with accompanied by a significant other, and they would come back to my office the following day for the first of 2 or 3 integration sessions. Opportunities to talk about what came up during the dosing session and what thoughts are on their mind. And we then followed people for 12 weeks after the dosing and saw how their illness progressed and whether they got better, doing rating scales all the time.
I understand that some of the participants no longer qualified as having a clinical diagnosis of depression. Does that mean they were cured of it or just the effects of depression? And I wonder how long it took before the drug kicked in.
For many of these folks, the drug kicked in within the first 24 hours after dosing. And we had many of these people coming in the following day who denied any remaining symptoms of depression. For some of the folks, it might have taken a week to see an improvement. And for some, it was a couple of weeks before they got benefit from the dose. One of the problems that certainly is highlighted by the study is that there were some people who met, in fact, our primary outcome measure of having significant reduction in their depression at week 3 after dosing, but were depressed again at 12 weeks. So we're looking, again, this is a first foray to doing a large study with an ill, depressed population.
And as you know, psilocybin is under the category of a Schedule I drug, meaning it has a high potential for abuse and no currently accepted medical use. So for people wondering, what needs to happen before the federal government changes the policy, approves it for use. And I also wonder if, the stigma that's attached to psychedelics could be a barrier.
Yeah, I'm reminded of a quote that's been attributed to Mark Twain, which says that what you don't know won't hurt you nearly so much as what you know for sure that just ain't so. And there's a whole bunch people know or think they know about psychedelics that just ain't so. They're really not tending to be drugs of abuse or drugs of addiction. And I think that it got painted with this very, very bleak picture back in 1970, and we're having to undo some of the damage from those early misconceptions. So it is classified as a Schedule 1 drug, but it does not really have the same risk potential as some other Schedule 1 substances. What needs to happen for this to be approved is we need to demonstrate in at least 2 large clinical trials to the FDA that this has been an effective treatment for whatever indication we're looking at. In fact, the sponsor of the study that was in the New England Journal has just commenced the first of 2 phase 3 trials, and we're the first site that will be opened in the world to look at the phase 3 trial, which will be the 2 phase 3 trials will have 3 to 4 times as many patients as we dosed within the phase 2 trial.
Well, this is a really fascinating study, and it really could be groundbreaking for so many people who have no other options. So, Dr. Aaronson, will be following your research and hope to have you on after those trials wrap up. Thank you.
Happy to be here. Thank you.
Thanks.